Okay, so we have a patient here who is usually quite mobile and independent, but for some reason or another, she has fallen onto the floor, okay? You will always have your charge nurse come and assess a patient who's on the floor to determine if it's safe to get them up, and oftentimes, depending on the facility, you may even have a doctor come and assess the patient. So if you're waiting for somebody to come to assess, you make the patient as comfortable as possible. Once you get the okay to get them up off the ground, never ever reach down and lift because you're going to twist and strain your back, risking back injuries. What you do is you bring a chair to the patient and you move it onto the right beside them, and you ask the patient to use the chair to help themselves up. As the nurse, you're going to support that chair to make sure it doesn't slide. So you place your hands on the chair, and I want you to get your knees underneath you into a kneeling position, and then if you can try to stand up from there. Once your patient is standing, you'll want to get them sitting on the chair just to assess for any further injuries, make sure that they're doing okay. So that's how you get a patient up from the floor. Now, depending on if the patient if they're less mobile and incapable of doing that, you may have to use what's called a hover jack and a hover mat, which I will post a video regarding how to use that. Or some facilities may still be using Hoyer lifts to lift a patient off the floor. It is not ideal. A hover jack is the best piece of equipment that we currently have available.